introduction and the didactic presentation take how many minutes? 20. Then this creates a community of practice that have content from experts and also a community understanding from experts in the field. We don't want to get vague things. We want to get information from the expert's mouth. Okay? So if it's an adherence counselor, who will you be looking for to come and give expert opinion in the session? Very good. I can hear Dr. Ngeno saying psychologist. Do you have one here? In Jootrh, GBB. Okay. But do you have a clinical psychologist in Nyanza? In the whole of Nyanza? And those are the people that you can invite. If you have an issue on mental issues, where did I see Arosto? She's disappeared. Oh, okay. If you have issues on mental issues and HIV, who will you invite? Professor is here. So you understand and select experts from the field that you will be presenting in that way. So how to get started? You should select who will be your target audience. And we've already selected the target audience to be the schools, being a few of the representatives who will develop the curriculum. Duncan will be able to work with a few of you, especially from Jootrh, on developing your local curriculum. And then you have to set your learning objectives. We all agreed that the sessions will run from Thursday to 3 p.m. So we have to set exactly what we want from the session and how many sessions we want to cover in 1 year. And then the content that will be delivered in person vis-a-vis the content that will be delivered through video conference. So I'll pose a few questions to all of you. Do you think you are a multidisciplinary team of healthcare workers? You are, Sidio? And you're all represented here. So the target audience for ECHO is not only for one type of cadre of healthcare workers. It's not only for clinicians. It's for everyone. Records. We could also take, they are called what, the ones from maintenance.
Medical engineering.
Medical engineering. You know, they're also doing medical engineering. They are repairing your medical equipment, okay? They are also multidisciplinary. And they will assist you in one way or another when they listen to your session. When they listen to a session and hear that the patient did not get his echocardiogram. Is it called an echocardiogram? Because it had broken down. Will the person repair for you?
No, they just call me.
They will just call?
Usually, when you call them, they now say, let's call the engineers to come.
But they will facilitate for you the They will facilitate for you the session so that you are able to understand how to be able to repair that. So making sure that multidisciplinary teams attend, it's very important. Then it should also, our curriculum is based on the National Test and Start curriculum. You will see from the curriculum, because I will show you, I have a sample that we shall be discussing on Thursday. It's based on the HIV curriculum from the National AIDS and STI Control Program. So the format for the region or the regional format will be a weekly teleconference for the next 6 to 8 months. So Jootrh being the regional hub, we host weekly teleconference forums. I don't want these forums to be today. This week we have a forum, next week we have no forum. Danica, you're the one leading these sessions. So the program should be on a weekly basis uninterrupted. Every Thursday, 3 p.m., I'll also log on and see all of you. If Masogo hasn't logged on, we call you by phone and hear what happened that you are not able to log in to the session. Silvio, do you have any IT problems that we can be able to help you so that you can log in? And then the session starts first with a didactic session for 5 minutes. Then from there we have the case presentation that are prepared by the health facilities and sent in advance. So let's discuss further on that. When will you be receiving the case studies, Danica?
At least a week.
A week before. Can we agree on the dates for sending the cases? If the MDT happens on Thursday in Jootrh, when will you be sending your case? Sunday. Friday. So, like, how many cases do you generate in a week? 4 to 5. So you will be selecting, can we say a maximum? We give Jootrh the maximum of 2, and we give the facilities 1 case per week. Are we together?
Yes.
Is it comfortable for you to give 1 case per week? Masogo, you are the farthest. Masogo, you are okay. Will you give 1 case per week? Ahero, Kosge, 1 case per week. Madian, 1 case per week. You're saying yes or no? Okay, yes. Siaya, 1 case per week. 1 case you'll be able to get, or you have 2 cases because you are a referral hospital. 1. Ukwala.
Yes.
0 or 1?
1.
1. Which other one have I forgotten? Usigu? +1. +1 or +2? Okay. Which other health facility Paponditi? 1. Amira? 1. Yala? 1. Okay. Excellent. So we have agreed, and we have agreed with consensus, that all the spooks will be providing 1 case per week. But with all the cases that you'll be providing, Duncan and Peter will receive the cases, and it will only be 1 or 2 facilities that will present a case, or maximum 3 health facilities per week. Because we only have 1 hour for presentation and 20 minutes for every facility. Do we agree on that? Yes, Brenda?
If we receive about, how many schools? We have 10. Plus they have that 12 cases per week. And we only discuss 3 cases per week. We end up with a backlog of cases that will be pending discussion and going forward. I don't know how we're going to handle it.
So for the echo session, we are not taking over Nya West. We'll still be discussing the cases here, but still Nya West once a quarter will be able to discuss the cases. It's once a month. We'll be able to discuss the cases and give way forward. We are hoping that the national hub could open soon. And we are hoping that the national hub can open on the 1st of November. Then they will be able to take on more cases on a monthly basis. Dr. Wagude will also be in the team that will be developing the curriculum, and Barbara. So we'll agree and see if we can ensure that the hub is running, the national hub is running. Once the national hub is running, and it's up and running, then for here the cases will be discussed on monthly basis, naturally, by the national program and Nyawe seated here, if there were any cases to be discussed in collaboration. Yes, Carol?
Maybe also just to respond, I think when we are sieving the cases, there'll be cases that we are able to respond to, or some that have some data that is missing. So not all 12 cases would ideally make it to the forum for discussion, but all 12 cases would be able to get like feedback. I think that sort of differentiates it.
Yes.
So if you send in a case that you wanted to discuss, and we are able to review it and see that this one needs 1, 2, 3 further done, then we're able to give feedback to the facility to also build the quality of cases that are eventually discussed. So from the 12 cases, we'd be able to say, ideally, these 3 or these 4 really need to be discussed by a bigger panel. But these other 6, we could be able to respond and maybe get a way forward. So we'd also be engaging everyone in the team, and that's why it's creating like a pool of experts who would also be able to weigh in and discuss. So circulating on email and responding to them.
And I think for the chair who will be there on that day, thank you, Carol, they'll be able to explain and say that we received a case from Ahero, and we'll give you a brief outline of what you can do with this case. And then if you have received another one from Madiani, we'll be able to give you a brief summary and the recommendations for the case and the way forward for putting the patients on treatment. So that would be handled. Then for the national program, we'll ensure that we have monthly teleconference for the next 5 to 9 months for the project of ECHO. So they will still start with the didactic session, and then participants present their cases. We are envisioning, and we'll ensure that this gets into the curriculum, that the national sessions are longer and are able to accommodate more cases. But that will be determined when we are developing the curriculum. Are we together? Aye. Then you are aware, and we have discussed this, that once we conduct the sessions, we'll be able to provide continuous professional development points for your accreditation, for the clinicians and the pharmacists, the KMA codes that you scan, because we are a CPD accredited center, and for the spooks, Duncan and will be able to collect all the names of the participants, and then we'll be able to sign the books for the nurses, the clinicians, for any other associations that may require accreditation. We'll be able to do that. Okay? Hi. So I just wanted to take you through a sample. Any questions up to there before we go on to the next session? Self-explanatory. Sindio? Hi. This is our HIV tele-echo clinic curriculum that we are developing to use from this month to March 2017 with the national program. And we'll be discussing it from Thursday. We have a half-day meeting with the national program to be able to concretize the curriculum so that we are able to share with you, although you'll be able to do your small schedule or curriculum for the regional program, you'll borrow heavily from this curriculum. So the curriculum is very basic, and it's, we have how to invite and to enroll in an HIV echo session. And for you within the facility, will you be attending the echo session alone? Only the people who came here. You say, we are the only ones who attended echo. So the others, please stay in your clinical areas. On Thursday, 3 p.m. Caro. Oh, not Caro. Caro is not in her health. Brenda. Will you be attending alone? Will you invite other people in the hospital? Yeah, within the other hospital. Madian, will you go and say it's only for the people who attended the session? So you'll be able to attend, everyone will be able to attend the session. Sindio? Okay, very good. So when you go back, you'll have to invite everyone to attend the HIV ECHO forum. And it's good to communicate and even put a board outside because your facilities will be having the ECHO room, and say that you are invited for the ECHO session on Thursday from 3 to 4 p.m. And it's good for the whole hospital to know. And they have put their accreditation and licensure within the curriculum. Who is eligible to participate, the multidisciplinary team of healthcare worker, and then the course schedule, that is for the national hub and for the regional hub, and then the goals of the HIV curriculum. We are heavily borrowed on the new HIV curriculum. I showed you yesterday. You all have a copy? Duncan will provide you. Duncan, please provide them with a copy of the national curriculum. So the typical teleheco sessions begin with the introduction, and you saw from the mock session that we began with the introduction. What did Peter do when we began with the session? What did Peter do?
Introduced himself.
Okay, introduced himself, then he introduced the professors. Okay, so he introduced himself, then he introduced the hub members so that they are able to participate. And then what did the spook do as they were watching us? It's because they are learning. It's because they are learning. So the spook took over and everybody wanted their faces to be seen. Everybody was like, are you seeing me? So the spook took over, but they never took over with an intention of doing a coup. They just took over so that their faces can be seen. Yeah, but they introduced themselves. Did they introduce themselves?
Yeah.
And then from introduction, they were able to listen and also present their case. So they did the case presentation, and then the professors back at the regional hub did what?
There were questions. They opened up for questions, if any, that were of interest to the team of experts.
Excellent.
Yeah.
And the team of experts were able to respond. Okay, that's good. I can see you are not asleep after that. So the curriculum will also outline how to participate in an echo session and how to get online. We've already set you up as the spooks and as the regional hub on Zoom. And Marcel and his team, the two Anthony 1 and 2, will be able to come and set you up so that you are able to log in. You'll be able to log in every time. He'll be sending you an invite with a number where you call in and you're able to participate as a team of ECHO experts. Then we have the curriculum, and you can see the curriculum is modeled on the HIV test and start guidelines. We have module 1, which is HIV testing services and linkage to HIV care and prevention. So we've even put the dates. That's in October. We want to start on Wednesday 5th, setting for HIV testing, but we'll be able to push it forward because we have just started the orientation. And for here, we'll be able to give you a timetable of the sessions that will be going on a weekly basis. So this will be communicated even a month in advance. You'll be having the whole curriculum that will be covered a month in advance. And you can send in your cases as frequently as possible. So you'll see even in November, cases that will be discussed will be of the initial evaluation and follow-up for people living with HIV, and then the standard package of care for people living with HIV. And this is how we would like also your schedule set for the whole year. So that we are not saying, at December, Nini, what will we discuss? Next week, what will happen? Then we are all wondering what will happen. You know, it's good for you to know so that when even you're looking for the cases, you're looking for cases specific to what will be presented. If this week we have prevention of other infections and nutrition assessment, you'll identify cases that are focused on the didactic session that will be given for the week, okay? In advance. So up to there, Swali Oyote, any questions?
Question.
Yes.
You talked about introducing the members of the ECO panelists. Let me give them that.
Yes.
I can see somebody already waiting for us. Carla Johnson, eh? He's already waiting.
Hi, good morning, good afternoon, everyone. This is Carla from CDC headquarters in Atlanta. I just, since I was invited to the call, I thought I would join, and this is all very exciting. Sounds like a great plan.
Hi, Carla, how are you?
I'm doing good. Sorry I'm not on the video portion, but I'm in the office in all these cubicles, so I thought I would spare you the
the cubicle. Yes, we have a team from the regional hub. We are within the regional hub in Jootrh, and we have a team of 30, 35 from the 10 spooks and from Jootrh. And we are happy that you have joined.
Thank you so much for that welcome. And if during I'm going to have to hop out at 10 o'clock for another call, but if you have any questions for me or need to discuss anything, I'm here till then, okay?
Okay, thank you, Carla. The team, do you have any questions for Carla?
We are not seeing her.
Say hi, loudly.
Hi.
There she is.
Okay, here I am.
Hi, wave. Hi. Yeah, that's nice. Any questions for Carla? You're shy now.
Thank you very much.
Yeah, thank you very much. This is the orientation, and we are very happy that you sponsored this event.
I am so delighted that this is happening in Kenya because it has brought so much additional support in Namibia, and we've got other pilots breaking out all over. So I'm so excited to hear about your experience as well. Thank you so much.
Okay, thank you so much. Maybe briefly, because we have just completed the session for curriculum development, you can just hear a few words from the spooks, where they are coming from. And we can begin with Jootrh. Dr. Brenda, start. Come here.
Okay. Hi, Carla. This is Dr. Brenda from Jootrh
Jootrh, which will be the regional hub for ECO. We're excited to have this program on board. Oh, okay. Then can you hear us, Carla?
And I have you, I keep it muted when I'm not speaking just because I don't want any external noise to.
Okay, thank you. Okay. Then we have a regional spook. Then we can have the next regional spook. Masogo.
Okay, hi, I'm Immaculate Atieno, clinical officer at Masogo Sub-County Hospital. Pleasure.
Hello, I'm Eunice Mado from clinical officer from Bondo Sub-County Hospital. Hi, I'm Dr. Ngeno. I'm with ICAP. I'll be supporting the ECHO program at the region.
And I'm Mark, also from ICAP, supporting the ECHO project.
Okay, then we have Ahero. Okay. The next book.
I'm Emmanuel Mouko, clinical officer at the Yara Sub-County.
Okay, Emmanuel, speak up.
I'm Emmanuel Mouko, clinical officer at the Yara Sub-County.
Yes, then we have Masogo, the other spook, Usigu.
Hello, this is Daisy Oulu, records officer from Usigu Center.
Okay, thank you. Then the next health facility. Okay, Paponditi.
Hi.
Come here.
I'm David Awino, clinician, Papunditi Sub-County Hospital.
Hello, I'm Stanley Koskei from Mayaro County Hospital. I'm a clinician.
Hi, Angela Mtwang, HRIO Madian Sub-County Hospital.
Okay, Madian. Then we have Siaya County Referral Hospital.
Okay, my name is Kennedy Nalo, HIV coordinator, Siaya County Referral Hospital.
Then we have, yes.
Hello, my name is Jackson Ondaro, clinical officer from Ambira Sub-County Hospital.
Then we have Matron Jane.
Hello, I'm Jen. I work at Jootrh Chamanas, ready to join the ECHO program.
Who else have we left? Oh, yes.
Last but not least.
Last but not least.
Hi, Carla. Are you able to hear me?
I can hear all of you very well. You have a very good connection.
Yeah, I'm Nova Sajuan from Ukwala Spoke. We are happy for this. I hope it will change lives.
So nice to meet you all.
Okay, thank you, Carla, and feel free to keep joining us as we continue with our session. And as we wait for the next session from at 4:30 from our headquarters on the evaluation and from the evaluation and from the focus group discussions. Thank you. So any questions up to there on the curriculum development? So Duncan will be coming around to collect your views on the curriculum. He will also be sitting with you so that he's able to understand your needs and be able to understand any other topics that we need to include in the curriculum. We'll also be having the national curriculum development on Thursday, and we'll keep you posted on the issues that will be discussed at national level and how this will be cascaded within the schools. Okay, moving on. As we wait for the session on the evaluation, I have sent the survey monkey, the evaluation for everyone to fill online. Do you have your laptops? Has everybody received? Even from the Kabambe? I told you, Project Echo, we want to go paperless. We don't want to use a lot of papers. Even the evaluation for your learning will be done online. We send a survey monkey to all except have you been able to get your sessions? You've gotten? Bad. Okay. Just hold on. If it doesn't come through, we'll bring. Now, moving forward, I think we also need to reevaluate and see. Have you understood from the first day what we've learned before the New York team joins us to do the protocol? Can we recap and see what we've done from day one? And I'd like Duncan to come along and recap with you. Have we understood properly? So that when we are going back home, we are also able to ask for support, ask for help. We'll all be here. We'll give you our contacts. Duncan will be able to give you his contacts. Peter will give you his contact. We have Carol here in the region. And we'll be able to support you both remotely and physically. So Duncan.
Thank you very much.
As I'm taking
Thank you, Dolly. So I think it has been 2 days, yesterday and today. And I know at different points we've appreciated a lot of things. Yesterday was mainly presentations, but today it was a lot of doing. From morning we had a chance to practice how to log into IECO. Then you also had the sessions, hub and spokes, and it was really participatory. So I don't know what we will say. Probably we can start with yesterday. What was the take-home message yesterday? Did you learn something yesterday? Yes, what did you learn? Ulijifunza nini geni? Yes, Fred. Yeah, so Fred is starting that we learned the difference between a spoke and a hub. And what is the difference?
The hub is the central side and the spoke.
The periphery, and there are different functions that happen at at the different sites because they have the main facility with panelists and experts and consultants. And this really came out even in our ECHO sessions today. Thank you, Fred. Another thing that we learned yesterday, let's start from yesterday, then we come to today. Another thing that we were able to appreciate yesterday, yes, Eunice.
Yesterday I learned about the Echo Box where I can log in and get some documents or some books on the Echo Box.
Yes, a very useful resource. Echo Box where you can log and get previous presentations, and you can also upload presentations. Thank you. What else did we learn yesterday? Yes.
It's a lot about
IECO, yes. Yes. Yes, IECO still on IECO. Thank you very much. What else? Yes. Yes, case identification very important. And we realize we've given ourselves a target of 1 case a week. So if we really have a very clear strategy of identifying cases, then this will really be possible. So yes, we really learned about case identification, plus other strategies that might apply in your facility. If you feel that other than chat review and clinical encounters, during the clinical encounters identifying difficult cases, refractory OIs that are not responding to standard therapy, then probably that will still increase on the number of cases that we will have. What else did you learn? Probably this was just an emphasis, not learning anew, that the standard form is really necessary that we use. If we are to discuss cases in a uniform manner, if one of us will use a full scarf and another one, the standard form, and another one, the backup at psychosocial appearance, first appearance session, when you jot something small, then probably it will not be standard and uniform to make a case for discussion. What else did we learn yesterday? I think that wraps it up for yesterday, introduction to ECHO, then IECO, and just looking at how we can have a resource and the summaries. For today was more involving, participatory. So what did we learn today? We probably can divide and say before tea. Before tea, what did we learn? Before tea break in the morning. Did you learn something?
Yes.
Yes. There is process of logging in. So you are now comfortable in logging in. How many of us are comfortable if they go and sit before their laptop or desktop, they can log in? All, Yeah, that is good. Let's clap for ourselves. 1, 2, 3. So despite the feedback that you are saying that IT is a bit slow, but we are somewhere in terms of IT. So what else did we learn? What else have we learned today? Logging in. What else? Yes?
How to capture people details from a phone account, health centers, and personal information.
Yes. Yes, how to capture the details and document and still using the unique identifiers. Yeah, that is one of the things that was we really engaged today. What else? We are okay. Before tea or after tea? Now we are freestyle. We have moved from before tea. Now anything that we engage in today.
So we were able to engage in a practicum where we discussed cases from facilities and we were able to solve those cases at the hub, and the scope was actually connected to us. So we engaged in a live echo session.
So live echo sessions. Thank you very much, Dr. Makomero. So there are a lot of learning points from that live echo session. One was that during a session,
You put off the, you put off
let's have our answer.
VTC ticket.
Yes, so the etiquette, yes. So the etiquette, like phones should be on silent and you don't respond during a session, or even movements are limited during a session. What else did we learn? Here, actually, all of us should be contributing something. Yes, Immaculate has a point that we avoid making faces during a session. That we are being watched. Many spokes are in attendance, so if we make a face, we might disrupt the whole session. Yes, another point. Yes, Doctor. Yes, prior preparation before the session starts. Because as we agreed that it's Thursday 3 p.m., if at 3:10 now we'll still be moving and pulling a chair, so probably we're looking for the case to present. Then this one will disrupt all other spokes and even the hub. What else? The order of presenting a case. What did we learn in regards to the order of presenting a case? How do we start? We started with the introduction. Yes? Of participants where? Yeah, so I'm being alerted that the presentation is soon kicking off. So I think that's what Stanley was saying, the order of introduce the participants, the audience and the spokes, then the hub. Then now we invite presentation of the case or the didactic, whichever may apply first. Then we have clarifying questions. Then we have inputs. All of us are experts, so we will not assume that after clarifying question we just go to the panel of consultants. So we'll have inputs from all of us. Then a wrap up from the consultants. Then recommendation and way forward. So thank you very much. It has been an interesting 2 days. Now is the time to listen to our colleagues also from New York and get to hear what they have. Thank you.
Okay. So thank you very much, Duncan. And I can now see we are joined by University of New Mexico. We've already greeted Carla from Atlanta, and we are joined in also by Maria from ICAP New York. So wave your hand. Jootrh from New Mexico. So this is the team of the Nyanza region experts that are being oriented or immersed into ECHO. And we've had a 2-day session, and now we were waiting for Maria to begin her session on the evaluation protocol. So thank you very much. And Maria is online.
Thank you, and very nice meeting you, everyone. I'm hoping that you had a very productive meeting. We also have Alison George from ICAP on the line, but she doesn't have the video on, so you won't be able to see her. So I'm going to share my screen. I have a little presentation, and the idea is to walk you through the evaluation plan for this Project ECHO pilot. 1 second. Great. So I wanted to give you an overview of the plans to evaluate Project ECHO in Kenya. We have the slides available, and we can share them with you later for your reference. So when we designed the evaluation, we had two objectives in mind. The first one was to determine the feasibility and acceptability of the Project ECHO model in Kenya. And then objective 2 was to measure the impact of Project ECHO on providers' knowledge, self-efficacy, professional satisfaction, and acquisition of CPT points. For each objective, we had specific evaluation questions. For objective 1, we wanted to know, has Project ECHO program been implemented as intended? What resources were needed to implement the ECHO project? And what have been the challenges in the facility of implementation of Project ECHO? And then for evaluation, for the objective 2, we also wanted to ask these following evaluation questions. How has knowledge of HIV care and treatment changed among providers participating in Project ECHO? How has self-efficacy changed among providers participating in Project ECHO? And finally, how has professional satisfaction changed among providers participating in Project ECHO? You're probably well aware of the sites that were selected for the pilot, so I won't get into that. But I wanted to just show you this table, which is a good overview of the different objectives, evaluation questions, and the methods that we're going to use to try to address these questions. I'm going to go one by one, describing each one of them. You also can see here the data sources and then the timeline. So for example, we'll be talking about the process evaluation, focus groups, in-depth interviews, midterm throughout the pilot. We'll do knowledge assessments, pre and post-test scores after each module. And then finally, we'll do self-efficacy and professional satisfaction assessments after each module and at the end of the Project ECHO pilot. This slide presents the inclusion criteria. So you will see, for example, the way we are deciding who to include in the focus groups and in-depth interviews. And we'll talk a little bit more about that when I describe each method. I'm going to keep going, and maybe if people have questions, we can take them at the end. So now I'm going to describe one by one each of the different components. The first one, you remember we talked about process evaluation. And in this case, I think by now you're probably experts on iEcho. So the idea is that the training coordinator will use iEcho to track process data for teleecho sessions and activities. So for example, after each session, they will record how many people attended by spoke, what were the didactic presentations, number of providers, etc. Then we would also be tracking resources for implementation, such as infrastructure, staffing, IT support, training, data collection, and others. So this we see as what we call the process evaluation, all the inputs that we're providing for the pilot. I won't get into the detail of this slide, but I just wanted to let you know that we have a list of indicators with the definitions, the data source, and the frequencies. And this we're using from, and I should have said also that we have adapted this from the Namibia evaluation protocol that was developed by CDC. So we're trying to standardize questions across evaluations so then we could eventually do a multi-country assessment of Project ECHO. And just as an example, the first indicator is proportion of planned teleecho sessions that were conducted. So I won't get into the details of each indicator. Then we're going to have focus groups discussions. We will do this with providers who attended at least 40% of the ECHO sessions, and we're going to do the focus groups using Zoom, which is what we're using right now. The purpose of the focus group discussion is to get feedback on the practicalities of participating in teleecho sessions. So for example, whether providers found this useful, what were their thoughts on the CPD credits obtained, what they thought about selection of patient cases, etc. This will be held halfway through the pilot, And the idea is to do 3 focus groups total with 6 to 8 participants, and we want this to be as representative as possible. So we would try to make sure that there's members from each of the different spokes and hubs. We're going to be doing verbal consent, given that it won't be in person, and we're going to use Zoom technology. And then finally, in order to select the participants, we will be contacting providers by email or phone and ask them if they want to participate in a focus group. Here I just took 2 questions from the focus group discussion guide just to show you the type of questions that we will be asking. So for example, the first question is, why do you participate in Project HIV Clinic sessions? And then we ask about the facilitators and barriers for participation. And then another example of a focus group discussion question is, what do you think about the short didactics? How have you used what you learned, and how could this have been, or how could this be improved in the future? So very general and mainly on feedback on participation and things that could be improved. The second method we're going to do is we're going to be doing in-depth interviews with facilitators at the hubs, and this will include mentors, clinic administrators, and leads, and we will also be using Zoom. So in this case, we're going to be asking for feedback on the practicalities of facilitation of echo sessions. So we're more interested in the perspective of the mentors and the leads, for example, on whether there were operational and logistical issues, their thoughts about sustainability, etc. And in this case, we will also be doing this, incorporate their feedback and at the end of the pilot, and we will be doing 10 in-depth interviews total. I also added some questions from the in-depth interview guides. For example, we asked them about the case scenario presentations, and then we asked them what could be improved on this case presentations in the future. And then we asked them about, for example, their thoughts about the time that the sessions are held and whether they think that the sessions allow for maximum participations, as well as ask them about the duration. So this is just examples of the type of questions we'll be asking in the in-depth interviews. The next method is to do knowledge assessments. This will be based on the core competencies and scope of practice for key clinical providers. The idea is to do this before and after each module, and this will allow us to measure the change in each individual's performance on the knowledge assessment. So the idea is, for example, before the module, we'll ask the same question as before, and we'll see whether there was a change in knowledge. Also for the post-knowledge questionnaire, we will also ask them a few questions to evaluate the quality of the session to provide feedback on the curriculum. And this is the knowledge assessment is something that we have not yet developed for Kenya, but we have other examples from other countries, and we're waiting for the curriculum to be finalized. And then moving forward, we also have the self-efficacy and professional satisfaction. This will be done at the end of each module or pilot. In terms of self-efficacy, we will want to ask providers' perceptions of their own skills and levels of expertise in serving as a clinician before and after the training. We would ask questions, and the answers will be none or no skills, through a scale to expert and able to teach others. And I'll show you a few questions in a minute. At the same time, we'll do professional satisfaction assessment. We'll ask them about the level of jobs. We'll also ask them about the perception of professional isolation and opportunities for self-learning and education. And remember, this will be done at the end of each module or at the end of the pilot. this is an example of the self-efficacy tool that we have developed. And you'll see some of the questions. I have not added the legend here, but as I mentioned, 1 represented no skills, and then 5 was what we call experts, or being able to teach others. And you will see here that we have several questions, and we ask them to self-assess themselves before the training and after the training. This will be specific to the content of the sessions. Similarly, with a very similar structure, we would ask questions about professional satisfaction. So for example, some of the questions you can see here is, I feel professionally isolated at work. And then we would ask providers to rate themselves in a scale of 1 to 4 before the training and after the training. So overall, and this is my last slide, when we think about the potential findings of this evaluation, we want to provide informative feedback from providers and facilitators that may help improve the delivery of the model after the 6-month pilot. We want this to serve as a proof of concept of the Project ECHO model in Kenya, as well as inform national adoption and implementation of ECHO clinics in other clinical domains. So we've reached the end of my slide, my presentation, and I think we could open it now to clarifications that you want from us. Thank you.
I think we'll begin with questions from the spooks, the 10 spooks, and then from the rest of the audience. So I can see we've been joined by Tom Spara from CTC Atlanta. Tom, hi.
Hi there.
Okay, hi. Say hi to Tom.
Hi.
Okay, and then I think there is Laura Tyson. Laura, these are the Nyanza region spooks and the hub, the regional hub.
Hi, nice to meet you.
Hi, Laura. Okay, thank you. So we open up the session to your questions. Any questions for Maria? You can come here. Brenda? Any questions? It is self-explanatory.
Maybe I can ask a question for the group.
Okay, I can also see we are joined in by Ken Masemora. Ken, hi. From CTC Kenya. Okay, it's very difficult. Okay. Yes, Maria, maybe you can go.
Yes. So if there are no questions, maybe I have a question for the group. What are your thoughts about the evaluation methods? And can you think of other questions or methods we could use to evaluate projects? I know it's a hard question.
I think you cut off.
Okay. I wanted to ask the team for their thoughts on the evaluation. Do they foresee any challenges to implementing this evaluation? And whether they have other thoughts of other things that we could do to evaluate on Project ECHO in Kenya?
So did you understand? Any other evaluation questions or indicators that we could collect from the Project ECHO in Kenya? Come, Karibu. I think you will stand here.
Like many of our colleagues from outside, I'm Jen. I'm a nurse. I work at Jootrh. Hello. One of the problem indicators that we might have for now, that at Jootrh we may be having the machines working well, but our other colleagues who come from the periphery may take a bit of time before we reach together.
Okay.
And is this more in terms of implementation of Project Echo? I'm thinking the computers. Is that what you were referring to?
Of course, maybe the Kenya system, the network has not gone down to the peripheries where most of the problems are. And for now, if there are other facilities that don't have computers that can make them work like we do at all other service points.
So, yes, Maria, Matron Jane wants to know if we can assess the internet connectivity within the spokes and the region in the evaluation.
Right. And that's a great point. I mean, I believe that we did evaluate a little bit during the rapid assessment before we implemented and decided the spokes. And this will be captured in the process evaluation. As you remember, I mentioned that we were interested in issues with internet and connectivity, and those will be things that we will be collecting as part of process evaluation. And then there will be definitely lessons learned about how hard it was to connect in the different spokes. So this is a really good point. Thank you for bringing it up.
Okay. Thank you. Yes, Carol?
Okay, my question would be in terms of, would there be a way we can evaluate the quality of cases from the time? I know we are assessing the knowledge of the participants from the spokes, but is there a way that we can evaluate the quality of cases that come in for discussion as at the beginning of the project and as at the end of the project?
Oh, that's a really good idea. So the way we have thought about it is that in the focus groups and the in-depth interviews, we will be asking halfway through the project what they think of the case studies. But it's true that would only give us cross-sectionally, like their view at midpoint. And we can try to improve those at the end of the pilot. I think that the challenge that we had is we also want to like minimize how many questions we ask providers and facilitators. So we're trying to balance between getting enough information and asking. Ideally, we would ask them questions after each session, but we realized, and also learning from the experience in Namibia, that we also have to be careful with burning people out with a lot of questions. So this is a great point. I think we can take that into consideration and see whether there's a good way to really take this into account. I don't know if colleagues or Jootrh or colleagues from CDC have other suggestions about this point.
Let me ask if the questioner might have some ideas on how to evaluate that herself.
Right back at me. So I was just thinking in terms of if we are assessing the knowledge for the different spokes and the participants, I think the other thing that would also demonstrate the change in terms of knowledge would be the quality of cases and the quality of discussions that take place. So I was thinking in terms of what is the level of interaction in terms of the input that is being given by the spoke, by the participants who've been there from the beginning, sort of over time, to just be able to assess what they can, in terms of their knowledge, a more objective way as opposed to the subjective way of just, yeah.
Right.
That would be my thoughts.
Right.
Could we perhaps create a scale that the participants could use after each case presentation to evaluate the cases, how relevant they are to themselves in terms of their work, or how good they felt the discussion was, or some questions like that after each session?
Mm-hmm. So we had thought about doing questionnaires after each session, but it was hard and it would be a lot of time consuming for the providers. So right now what we've done, and remember when we do the knowledge assessment, I mentioned that at the end in the post-knowledge assessment, we'll also ask them questions about what do they think about the module, and that's the time where we could actually ask them questions about the case presentations. I don't know what the team think. We thought from other countries that asking questions every session will be too much for providers. What do people feel? Would this be desirable at the beginning?
So this is Allison. Can you hear me?
Yes, Allison.
My understanding of the question or the proposal is that we have some sort of objective method for evaluating the level of interaction and quality of discussion around the case studies. And I think one thing we could do really is just a general recording of about the percentage of time dedicated to discussions or something like the number of comments or questions made by participants. I think one of the tricky things there is that to objectively rate the quality of a conversation can be difficult because you might have more than half the session be discussion, but that might be one person asking the same question over and over again and not really understanding the answer versus a really in-depth conversation that takes the same amount of time. So I like the suggestion of trying to have an objective measure for the quality of cases and interactions, but I think off the top of my head, I don't have a solid indicator for how we would do that. But I think it's definitely worth considering. And I don't think it would have to be done through adding additional questions at the end of a session. I agree that we don't want to cause fatigue by asking too many questions of participants and making it seem burdensome to attend and then have to evaluate each time.
Perhaps rather than having it after each session, maybe after a group of sessions or sporadically throughout the program.
Right, and the idea was to do it after each module. So definitely we would be including questions about the case studies when we ask them questions about each module. Yeah.
From the team here, I think asking questions at the end of every module will make more sense because sometimes the sessions only go for 1 hour. So we do not want the sessions to go for more than 1 hour. We've agreed all the sessions will be conducted on Thursday from 3 to 4 p.m. So we'll have case studies and modular presentations of the sessions in line with the curriculum. So if we can have maybe questions or evaluation questions asked at the end of the module, it will be very important. What do you think?
Right.
At the end of every module or continuously? Okay, every module. So they are all in agreement for at the end of every module.
Great.
Okay. Any other questions to Maria? Yes? Okay. Okay. We have an IT question. Yes, Anton, come here.
Hi, Maria.
Hi.
Now, the question I just want to ask is, because since we started the Project Echo Immersion training, we have been doing the recording of each and every session from yesterday morning to date. Even right now, this session, we have been editing it. Recording it. So my question to you is that, would you propose to us any video recording and video editing software which you can use to edit? Because there are some section of the recording we would like to upload in the Echo box. So before we do the upload, I would like to cut out the unwanted part before we upload. Thank you.
Thank you. That's a great question. And actually, I wonder if our colleagues from University of New Mexico would know. I'm not that familiar with how much you can export the video and do editing. Jootrh, do you know if that's possible?
So what we do, so the video, it will save to your desktop or your computer, wherever you tell it to. And then what we do is we upload the videos to YouTube, to a private YouTube channel. And within YouTube, you have the capability of cutting out parts of the video. For example, most clinics only record the didactic, but not the case discussion part, and share that didactic part. So you can just, edit the video and cut out the part that you don't want to share in this private YouTube channel. So then the link gets shared to the network, to the community, and we also share those links within Box as well, or in our HIV Meta Echo Collaborative, we are sharing links to recorded didactics. Does that answer the question?
Yes, thank you very much, Jootrh.
You're welcome.
So any other questions from the health facilities, the schools, for the evaluation that has been discussed? Will you be able to fill in the evaluation questions as participants? Okay. Yes. Okay, Dr. Marco Mere is the clinical pharmacist within Jootrh, supporting ICAP. Yes?
My question goes to Maria. Sorry, it's a dead question. Just about measuring the implementation of the project. I was just looking through the indicators that have been populated and wondered maybe instead of just having number of cases reviewed or presented in didactic sessions, I think it would be a great idea to look at patient outcomes out of the cases that were discussed during the echo sessions. How can we follow those patients and look at, has it led to improved quality of care in terms of evaluating patient outcomes? Because at the end of the day, it's the patient we're working for.
Right. So thank you for bringing this up. That's like the $1 million question. and I think we've been discussing a lot how we can really see whether Project ECHO has an impact on the outcome of patients. We don't think there's so many other things that are going on at the same time as we're doing Project ECHO, including potentially the launch of TEST and START in Kenya, that I think from an evaluation perspective, it would be really hard to link directly the improved outcomes with Project ECHO. I don't know if people have suggestions. We've been thinking about this a lot, and that will be really the main outcome of the project, to really make sure that and evaluate whether Project ECHO has an impact in improving patients' outcome. I don't think it's that easy, but we're welcome to any ideas and suggestions. And that could potentially be almost like a phase 2 of this evaluation. Probably would need a little bit more money to really abstract data or get the data from the facilities. But I'll be curious to hear your thoughts about how we could do this.
The idea is that because today morning we went through a session, the iEcho, where there are patient level files that you can actually have that information prior to discussions. Probably, if there was a provision within that iEcho to really be able to update the outcome of the intervention for that patient, then we can extract that data and really evaluate out of maybe 100 cases that have come through the ECHO, how many actually resolved? How many? What was the outcome? Is it? Did the patient get better? Did they die, or what happened? Probably from that perspective.
Right. I think if we're only looking at the case studies, the patients that are presented, it's easier because we have more control of who they are, and we know that they had received support from Project ECHO. I think it would be harder if, like, the bigger picture is, besides the case studies, are we really improving health of patients? And I think that will be the one that it's harder to evaluate. But I like your idea of, like, maybe the case studies, trying to do some follow-up and see what happens later. I think that the issue is that we don't have the counterfactual, like we don't know what would have happened to that person if it had not been a case study and had not received the additional support from the provider. I don't know, Jootrh or CDC, I know you have been looking into this for other Project ECHOs.
Well, Project ECHO has done one outcome study in HCV, but that is, as Maria indicated, it's costly and it's a lot more complex, and it involves, of course, following individual patient outcomes. And that wouldn't be through iECHO, that's it's currently through iHealth, which is also being part of the overhaul of the whole ECHO technology. So sometime in the future, that is something that may be possible through this new ECHO Health program that will be revamped. But yeah, it's definitely more costly. But the one thing I can say from the Namibia focus groups, somebody said that they felt like they used the knowledge they have from the ECHO sessions every day with patients. So just a statement like that seems that it should have some outcome on patients, but of course that's not the actual proof. Yeah.
Thank you very much, Maria, and I know you have many other calls, and from the Kenya Regional Nyanza team, we are very excited to begin these sessions. We've come into an agreement, and this is to inform also CTC Atlanta, who are with us today, Laura, Thomas Farr, and Jootrh from University of New Mexico, that will actively begin our ECHO session with the schools from next week on Thursday. Anthony, myself, will try and join you in as we are conducting the sessions, the first sessions, which we have seen have been a challenge this morning with the mock sessions. But I know you will help us through the session. So I would like just the team to give a few words of how the training has been so that all of you can hear. And maybe we will speak sporadically. Ambira, how has the training been?
Success, we have now the knowledge and we are ready to run and implement the ECHO project.
You have to come nearer to the...
As I've said, the training has been successful. We have the knowledge, we are ready to implement the ECHO project in our facilities when we are going back to the... Thank you.
Thank you. This is one of the remotest part of Nyanza, and they are part of us. Then we have Siaya County, Kennedy. What did you learn for the 2 days?
Thank you very much. We as a team, we have learned a lot. We have learned several things from ECHO we are going to implement. I know sometimes we may have very few challenges, but those ones will tackle them as we continue implementing in our facilities. We've had able teachers who are very knowledgeable, who has given us information for the 2 days. We have learned a lot of things. In fact, I cannot just express all of them now, but we've learned a lot of things. Thank you so much.
Okay. Thank you, Kennedy. We also have a team from Yala.
We have run a lot of things as per the ECHO. It will improve the academics and the health of the patient. That's what I have.
Okay. And then we have Usigu. Okay.
I think this was the best platform for me to learn a lot, and I hope ECHO will have positive impact on the patient and us as learners. Thank you.
Okay, then we have Paponditi.
Okay, first and foremost, I want to take this opportunity to appreciate the founders of ECHO. We've learned a lot, and the only thing remaining is implementation.
we promise to implement it thoroughly. Thank you.
Thank you. So they are promising to implement that. Okay, then which other facility have I left? Ambira. Masogo.
Okay, thank you very much. We've learned a lot on this ECHO project, and we hope it will change the life of our patients and to add more knowledge on scales. Thank you.
Okay, thank you very much. Then Madian were able to say, Madian is one of the farthest facilities in a remote area. We had to put a satellite dish through they have no internet connectivity, so they are using satellite. Very muddy and inaccessible to the world.
Thank you very much. We want to appreciate the team from America. We wish to implement this ECHO project even if it's in a remote area. I hope it's going to help us and help the management of patients. Thank you.
Okay. Thank you very much, Madian. And then we have Bondo. Yes. Bondo from the academic village.
Thank you very much. It has been a productive 2-day training, and we thank you for ECHO. This project, I know it's going to help us as implementers and even our patients. We are ready to roll it out.
Thank you very much, Bondo. And then last but not least, we will invite from